Hey guys, this is Fixer Med. Welcome back to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 43 of my multi part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at the ureter. The ureter crosses the pelvic brim near the bifurcation of the common iliac artery. In males, it is crossed superiorly by the ductus deferens near the bladder. In females, it is crossed anteriorly and superiorly by the uterine artery in the base of the broad ligament. Note: the ureter can sustain damage during a hysterectomy or surgical repair of a prolapsed uterus because it lies posterior and inferior to the uterine artery. Let's take a look at the picture to the right. The ureters, which are labeled as the number 4 on the diagram, are tubes that carry urine and connect the kidneys to the bladder. Let's next take a look at the nerve supply of pelvic viscera. Parasympathetic innervation. Preganglionic neurons reside in the sacral parasympathetic nerves, S2 to S4, within the spinal cord. Their axons travel through the pelvic splanchnic nerves and synapse with postganglionic neurons situated within the pelvic organs in the intramural plexus. Sympathetic innervation. Preganglionic sympathetic fibers from the T12 to L2 segments emerge from the intermediolateral column, also known as the IML, and course through the sympathetic trunk, forming sacral splanchnic nerves. These fibers contribute to the inferior hypogastric plexus, where postganglionic neurons are located. Branches of the inferior hypogastric plexus extend to organs, enveloping branches of the internal iliac artery. Sensory innervation. Sensory fibers from the dorsal root ganglions of S2 to S4 combine with parasympathetic fibers, transmitting pain sensations from the pelvic organs. Let's next take a look at the micturition reflex. Promoting emptying, parasympathetic fibers from pelvic splanchnic nerves initiate contraction of the detrusor muscle and reflexively relax the internal sphincter. Somatic motor fibers, via the pudendal nerve, enable voluntary relaxation of the external urethral sphincter. Inhibiting emptying, sympathetic fibers from sacral splanchnic nerves impede detrusor muscle activity and trigger contraction of the internal sphincter. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 40-year-old woman undergoes a hysterectomy for symptomatic fibroids. During the procedure, the surgeon inadvertently injures a structure running posterior and inferior to the uterine artery. Which of the following structures is most likely damaged in this scenario? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is B, ureter. The ureter runs posterior and inferior to the uterine artery in the pelvis. Inadvertent injury to the ureter during a hysterectomy is a known complication due to its close proximity to the surgical field, particularly when ligating the uterine vessels. Damage to the ureter can result in urinary leakage, infection, or obstruction. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, uterine artery is incorrect because while it runs close to the ureter, it is not posterior and inferior to it. Additionally, injury to the uterine artery during a hysterectomy is less likely to cause urinary complications compared to ureteral injury. C, ovary is incorrect because the ovaries are not typically located in the vicinity of the ureter in the pelvis, and they are not at risk of injury during a hysterectomy unless specifically targeted for removal. D, round ligament of the uterus is incorrect because the round ligament of the uterus is located anteriorly and superiorly to the uterine artery and is not at risk of injury during a hysterectomy unless deliberately manipulated. E, inferior epigastric artery is incorrect because this artery is located more superiorly in the pelvis and is not in close proximity to the ureter. Injury to the inferior epigastric artery during a hysterectomy is also less likely to result in urinary complications compared to ureteral injury. All right, now that we have covered this question, let's move on to look at the next question. A 55-year-old male presents with urinary retention and fecal incontinence following a pelvic surgery, damage to which nerve fibers is most likely responsible for his symptoms. All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is B, sacral parasympathetic nerves. Damage to the sacral parasympathetic nerves, S2 to S4, can lead to urinary retention due to impaired detrusor muscle contraction and fecal incontinence due to decreased anal sphincter tone. These nerves play a crucial role in controlling bladder and bowel function. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, pudendal nerve is incorrect because damage to this nerve would primarily affect voluntary control of the external urethral sphincter and anal sphincters, potentially leading to urinary and fecal incontinence, but not urinary retention. C, sacral sympathetic nerves is incorrect because damage to these nerves would primarily affect sympathetic innervation to pelvic organs, resulting in altered blood flow and secretions, but not urinary retention or fecal incontinence. D, femoral nerve is incorrect because this nerve primarily innervates the muscles of the anterior thigh and does not supply the pelvic viscera. E, obturator nerve is incorrect because this nerve primarily innervates the muscles of the medial thigh and does not supply the pelvic viscera or play a significant role in urinary or fecal control. All right, now that we have covered this question, let's move on to look at the next question. A 65-year-old male presents to the urology clinic with complaints of urinary urgency and frequency, as well as difficulty initiating urination. Which of the following nerve fibers is primarily responsible for the involuntary contraction of the detrusor muscle during the micturition reflex? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is A, parasympathetic fibers from the pelvic splanchnic nerves. During the micturition reflex, parasympathetic fibers from the pelvic splanchnic nerves, S2 to S4, stimulate the detrusor muscle contraction, leading to bladder emptying. This reflex is essential for the involuntary control of bladder function. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. B, sympathetic fibers from the sacral splanchnic nerves is incorrect. Because sympathetic fibers primarily regulate bladder filling by relaxing the detrusor muscle and contracting the internal urethral sphincter rather than initiating detrusor contraction. C, somatic motor fibers from the pudendal nerve is incorrect, because pudendal nerve fibers primarily innervate the external urethral sphincter, contributing to voluntary control of urination rather than the involuntary micturition reflex. D, sympathetic fibers from the hypogastric plexus is incorrect because sympathetic fibers from the hypogastric plexus primarily regulate bladder filling and storage functions rather than initiating bladder contraction during micturition. E, somatic motor fibers from the femoral nerve is incorrect because the femoral nerve primarily innervates the muscles of the anterior thigh and does not play a significant role in bladder control or the micturition reflex. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is Fixer Med signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.